Good afternoon, folks. I'm Bob Spur, Avon Fire Chief. Today is March 31st, 2020. We're filming just a little after 12 o'clock in the afternoon. And as always, I'm joined by our health agent.
Hello, Kathleen Waldron, the health agent for Avon.
Hi, Kathleen. So as we always do, let's start this off with a quick recap of numbers. Today, nationally, there are 164,845 positive, 3,183 fatalities. Massachusetts, 5,752 positive with 56 fatalities. Kathleen, how's it look locally?
Norfolk County has 628 positive cases. Plymouth County has 380 cases, and Avon has 4 confirmed positive cases.
Excellent, thank you. Townwide, we're still in the same position we've been for a little while now. Town buildings are closed to the public, although essential employees are still working. If you need 911, please call. If you need services from regular town hall or library, you can get a hold of them via either email or phone. The Council on Aging and the school department continue to work pushing out meals to people that need them. So the town is as we've been for a little while now, and things are going along. Kathleen, what's happening at the state level?
On the state level, the governor is predicting that the number of positive cases are going to increase between April 7th and April 17th. He's going to speak today, so maybe we'll have another update on Friday. As far as what people need to know, continue to social distance. I did want to touch base on social distancing versus quarantining. Quarantining is more for those who have been in contact with a confirmed case or are confirmed themselves. When you're in quarantine, you're not leaving the house. You're not going to the grocery store. You're not doing any of that. Whereas social distancing is what the typical Avon resident is doing at this moment. I'm social distancing. I go to work just when I need to. I'm trying to work from home as much as possible. When I'm around people, I'm 6 feet away. I only go to the grocery store just for necessities, stuff like that. So I just wanted to touch base and let you know there is a difference. I also wanted to let you know that there are some additional symptoms of COVID-19. The major symptoms, as we know, is cough, fever, and shortness of breath. But they're also saying that some people are reporting abdominal pain, chills, headaches, diarrhea, sore throat, vomiting, and muscle aches and pains. And also I've heard some people with nausea. So I just want you to be aware of those are some other symptoms, not just the 3, the cough, fever, and shortness of breath.
Great, Kathleen, thank you. CDC's got some new guidance. We're seeing actually a drop in ambulance calls. It seems like people are wanting to stay home, which is completely understandable. If you can manage your symptoms at home, you're probably better off there. But I just quickly wanted to go through the CDC guidelines, and hopefully this works. There we go. The CDC guidelines are to stay at home, monitor your symptoms, get rest and stay hydrated. If you have a medical appointment, please call your healthcare provider first and tell them that you have or may have COVID-19 if that's going on. If you call 911, and feel free, if you need us, call us. But if you call 911, please notify the dispatch personnel that you either have or may have it. Cover your coughs and sneezes. Wash your hands often, following hand hygiene protocol. Stay away from other people in your home as much as possible. So if you're positive, try not to get the rest of the family positive. Avoid sharing personal items, dishes, towels, bedding, things like that. And clean all surfaces on a regular basis. The high touch items are what you really want to work towards. That list that I just showed, because I'm not sure if it went up to everybody, will be on our social media push out. I'll send it to the town clerk so they can go out on the website. That's kind of the latest and what we want people to know if you're staying at home and managing this. Kathleen, do you have anything else?
I just want to say again, thank you for everyone who is practicing social distancing. I do understand it's very difficult. I think it's going to be a lot harder in the next coming weeks with the increase of cases. But we ask you to do your best to stay at home. And for those Avon residents, the compost site should be opening April 22nd. Again, that date is pending what's going on with the rest of the state and COVID-19. Thank you.
Thank you, Kathleen, and thank you everybody for watching. We plan on being back with you Friday. Have a good day. Stay safe.